Hello class, I'm Dan O'Kelly, and for the Module 7 PowerPoint Health Promotion Project, I chose to look at an interesting program in rural Alabama. It's with the help of the University of Alabama, and this is outside of Birmingham, where in rural communities they have an outreach program where they utilize something called community health advisors. So this PowerPoint is outreach to African Americans with CHF to enable health promotion behaviors utilizing community health advisors. So a community health advisor, this is a very interesting program. It's an individual, a layperson, and they're volunteers. These volunteers have been trained. They've been trained and they've been educated about the disease process of a particular disease. They initially started with hypertension and diabetes, and the community health advisor is a layperson from that community. They're of that community, so the people that they're helping, the people that they're serving, their uncles, their grandmothers, they're their neighbors, they're their family, they're part of that community, and they understand the challenges of living in that community. And they're an essential element to the outreach program. So the community health advisors, they've been trained by social workers, nurses, doctors, and they go out into the rural community of Birmingham, Alabama, outside Birmingham, and they work with CHF patients. Now, a little bit about CHF. CHF is responsible for 1 million hospital admissions yearly. That's an astounding number. There's significant morbidity and mortality associated with CHF, and it's even higher among African Americans. The CDC lists heart disease as a leading cause of death among African Americans, and CHF is most certainly a lethal disease. The Agency for Healthcare Research and Quality's report entitled the National Healthcare Disparities Report of 2014 recognizes the African American population as a grossly underserved population. This report encourages outreach with individualized patient-centered care involving family and community to address disparities. So this program really falls nicely and dovetails nicely into what the Agency for Healthcare Research and Quality recommends. As I mentioned, these community-based chronic disease management programs, they've been established in rural Alabama. They identify 3 key elements of support regarding outreach. One is emotional support. So people visiting somebody with CHF who's infirmed, they can't get out, they can't get to their doctor, they can't get to the supermarket, they don't have access. They're in their home and they're just getting sicker. So they provide emotional support to decrease stress and negative emotion that's associated with the disease process. Instrumental support. Instrumental support is providing tangible goods. It might be helping somebody get to a drugstore. It might be helping somebody get to the drugstore to get to their medicines, It might be getting durable medical equipment. It could be enabling somebody to get durable medical equipment like a shower chair or a walker to increase mobility, or a shower chair to address hygiene, or enabling access to these tangible goods. And of course then there's informational support, which is providing information that can be described as information designed to assist in problem solving or addressing barriers to health. So they can use books, they can determine whether somebody's computer literate, somebody has access to the internet, and if they don't have access to the internet, how can they get access? Do they have access to a public library? Do they have transportation to a public library? And from there try and problem solve and how they can impart information onto them using whatever means necessary. Community-based disease management programs, they've recruited and trained these laypersons. What they did was actually, during the interview process, they were offered gift cards, like $24, $25 gift cards just for the interview process, and then they picked appropriate candidates from there. They live as I mentioned, they live in this community they serve. the goal is to help bridge social and cultural gaps between minority communities and the healthcare system. It's shown to increase the likelihood that support is delivered in a manner that their peers are receptive to. So if you're working with people who understand the challenges of that community, who understand culturally and socially what that demographic is up against and deals with on a daily basis, they're more receptive to working with somebody like that. So the Objectives and Goals for Healthy People 2020 identifies access to health services as a major objective. Access to health services impacts the overall and physical and social mental health. Access to health services helps impact the prevention of disease and disability, the prevention of death. It helps increase life expectancy. Healthy People 2020 asserts that cardiovascular health is influenced by social, physical, and political environmental factors. Influencing these environments are access to healthy food, access to affordable, quality health care, access to educational opportunities, and opportunities for physical activity, including safe, walkable communities. So if you have a community that's walkable, for one thing, it's easier to access services and goods. It's easier to get to a store. In rural Alabama, things could be pretty far apart, and they don't have the same resources that a modern city or a suburb might have outside of Birmingham. So just the act of walking, and the act of walking a short distance, is healthy. And when that is a barrier to your health, that you can't walk because there are no sidewalks or because there's no good infrastructure, that doesn't promote health, and that's really a significant barrier to health. So access to affordable, healthy food has been identified as a significant barrier. There's a study by Robinson. Dietary behavior among low-income African Americans are described as a complex interplay. Personal, culture, and economic, social circumstances come into play. There's decreased intake of fresh fruits and vegetables among this demographic associated with poor outcomes. So there's probably not a lot of Whole Foods, and there's probably not a lot of trendy, healthy supermarkets in those communities. However, the role of the CHA can help identify what is the closest supermarket. How do we get to that supermarket? How many times a week do we have to go shopping? How do we set up a schedule to get you access to healthy food? There's also been some studies in deficiencies of micronutrients such as zinc and vitamin D that may play a role in outcomes regarding CHF. There's a particular study done by Dr. Arroyo that looks at the levels of zinc and vitamin D and the outcomes with compensated and decompensated CHF. The jury's still out on that a little bit, and as well as the more common information about sodium intake with CHF. All these things, all this information can be imparted to the community through CHA. The whole program, it emphasizes an individual client-specific learning approach. So in the needs assessment, socioeconomic status and resources are assessed, educational level and age. At what age does a person read at what grade level can they read at? Disabilities or physical barriers, whether somebody just needs a pair of reading glasses or if they're hard of hearing. All this can impact their overall health, and it can impact the outcome of CHF. Their willingness to learn, are they receptive to a program? Are they receptive to the CHA? And overall health stage, the stage of the CHF, the prognosis of the CHF. If somebody's in end stage, they might not be a candidate. They might not welcome that, or they might welcome the CHA just for comfort, for emotional support. So assessment of the program. There's ongoing outreach to African Americans. The assessment of the program and efficacy is to determine whether or not there's increased or decreased admissions, surveys clients and CHAs that focus on performance improvement and QI. The admission statistics we went over, expansion of the program to include perhaps other diseases, possible incentive for recruitment and retention of CHAs. Remember, these people are volunteers. So moving forward, outreach into rural communities in the Deep South will need to expand beyond its current status. Political engagement with local, state, and federal governments will be needed to improve access to supermarkets, doctors' offices, clinics, and hospitals. Improved affordable public transportation is needed. Rural and urban planning or suburban planning to develop infrastructure that allows for walkable communities, for safe streets, parks, sidewalks that can allow somebody just to walk to a town center, or access to a town center that it's a walkable area. Safe streets, parks, town centers that promote exercise, expansion of programs such as Alabama's CHA program. And here are my references. I'd like to thank you guys, and I learned something, and I hope you guys did too. Thank you.